Ever wondered what happens when you go to the dentist for a professional cleaning? Today, we're breaking down the step-by-step process dentists use to remove plaque and tartar, so you know exactly what to expect and why it's so important for your oral health. Let's dive in. The dental cleaning process, also known as prophylaxis, is much more than just brushing your teeth. It's a thorough procedure that targets plaque and tartar, especially in those hard-to-reach areas. Here's how it works. First, the dentist or hygienist inspects your teeth and gums using a small mirror and probe. They're looking for plaque buildup, tartar, cavities, and signs of gum disease like redness or swelling. This step helps them figure out exactly what needs attention. Next is scaling, where they remove plaque and tartar from your teeth. This can be done with a manual tool to gently scrape off the buildup, or with an ultrasonic scaler that uses vibrations and water spray. Most of the focus is on areas near the gum line and between teeth, where plaque loves to hide. Why is this so important? Because once plaque hardens into tartar, you can't remove it at home. Only a professional can do that. Step 3. Polishing. After scaling, it's time to polish the teeth. A special gritty paste and a high-powered brush are used to smooth the tooth surfaces. This not only removes minor stains, but also helps prevent new plaque from sticking to your teeth. Step 4. Flossing. Next comes flossing. Yes, even at the dentist's office. They'll go between every tooth to make sure no debris or plaque is left behind. Plus, it's a great opportunity to see if your gums are healthy or if they need extra care. Step 5. Rinsing. Now it's time to rinse. You'll swish with water or an antibacterial mouthwash to wash away any leftover particles or paste, leaving your mouth feeling fresh and clean. Some cleanings end with a fluoride treatment. This involves applying a protective gel or varnish to strengthen your enamel and guard against cavities. If your dentist offers it, it's worth considering, especially if you're prone to cavities. Advanced case deep cleaning, scaling and root planing. Host. If you have severe tartar buildup or gum disease, your dentist may recommend a deep cleaning procedure called scaling and root planing. This involves cleaning below the gum line and smoothing the tooth roots to help gums heal and reattach. Why regular cleanings matter. Host. So why is this process so important? Regular cleanings prevent tooth decay and gum disease. Keep your breath fresh. Give your teeth that smooth, polished feel. And let's be honest, they make your smile look amazing. Tips to prevent plaque buildup. Host. Between visits, you can keep plaque at bay by 1. Brushing twice a day with fluoride toothpaste. 1. Flossing daily. Yes, it's non-negotiable. 1. Using an antibacterial mouthwash. 1. Eating a healthy diet and cutting back on sugary snacks. 1. And of course, visiting your dentist every 6 months for a professional cleaning. Outro. Host. Smiling with text overlay. Like and subscribe for more dental tips. Host. Taking care of your teeth is one of the best investments you can make in your health. If you found this video helpful, give it a thumbs up, share it with someone who needs to hear this, and hit that subscribe button for more dental tips. Until next time, keep smiling.